Hello, everyone. My name is Michael Savoldi. I'm a retired uh, instructor at the California State Polytechnic University in Pomona, California. I was taught at the Animal and Veterinary Sciences departments. I also was the resident farrier for the W.K. Kellogg Arabian Horse Center, which is located on the Cal Poly campus. That was for about 30 years. I'm quite happy with my position down there because I always felt my job was my hobby. My side job was to study feet internally, so I would know what I was doing to a horse's foot. And it's been a long, hard study for me, but it's well worth it. And now I'm just trying to share with everyone some of the things I've learned. So pathology never lies. That's my favorite statement, or one. I have many favorite statements, but pathology never lies is one of mine because it's really hard to argue with pathology. I can usually demonstrate my point simply by looking at pathology and then studying the tissue that's around it or the causes for that pathology to develop. And this is an example of how we can advance into studying what causes pathologies. So we can start here with the midsection of a foot. So here we see, and you'll have to excuse me, this program I just haven't, I'm struggling with it because for my cursor here to work, I have to go out and in, or to advance the slide, I have to go out, and then to show my points, talk about certain areas, I have to go back and get my cursor. And forgive me, sometimes I just get carried away and forget to put the cursor in there. If you've looked at any of these other little lectures, you'll see that the cursor is missing in some of them. So I apologize for that, but I'm getting better. So what are we talking about? We have a toe area in the horse's foot, and we have a heel area in the horse's foot. And what we're talking about is the midsection of the horse's foot. It's usually around the area of the widest part of the foot. There's an interesting thing about the arch in a horse's foot. The horse is always standing on the top of the foot, on the top of its sole, one form or another. And so when the body load steps into the sole will flex outward. And then as the load comes off of the sole, then the sole will flex back. And that's primarily what's happening to this midsection. The bars are always weight bearing. 100% weight bearing. And so we're looking at damage caused primarily through gravity, because it always wins. We're also looking at workloads on horses, heavy body horses, heavy riders, increased exercises. All of those affect gravity, and that affects what happens within the foot. So let's go into this and look at a crease. If you look closely, we can see a crease coming down the commissure. Well, what does the commissure mean? I think simplicity, I can say it's just a portion between two anatomical parts. It's a little groove in here. This is known as the central cleft, or the cleft of the horse's foot also. There's Latin words for it, but we'll just stay with simple terms. I'll mention this cleft a little later on, and so now you'll be aware of the center of the heel here is what I'll be talking about. And then we can see on this side of the foot that is flattening. The crease, that sharp crease that we see here, coming down right down through here, is starting to flatten off and get wider. Well, how can I explain that? I have a piece of paper here that's got a little bit of a crease in it. Find my camera. Has a little bit of a crease right here. Well, how can I change the angle of this crease? I could pull it wide, and that would change the angle of the crease. And that can happen, maybe not to this extreme, but it can increase that angle, because as the foot widens through body weight and the collapsing of the arch, the foot will widen at the bottom. And that can change the angles of the bar. But what I'm talking about here is flattening. To flatten this crease, I need to just come in here and push down on our crease, and you can see that it's flattening out in this area. And that's what's happening right here. So what we can do now is, let's look at some motion. I have here a cadaver limb. It's been collected at a local rendering plant, and it's used for demonstration purposes only. But I'm going to put this limb in motion, and then I'm going to dissect through it so we can see the internal parts moving. It's really exciting to see because it helps answer a lot of our questions when we do this type of stuff. So let's see if we can first put it in motion, or let's get it in motion first. There we go. Now, as you can see, as the limb falls, well, one thing is we can see this heel is moving outward. And then as the fetlock returns, the heels retract or come back in. You notice that motion? So now let's look at another very important thing. This is the ear gut of the horse right here. And I would like you to watch it as it descends, how it aligns with the cleft of the horse's foot. I can help you by putting in a dotted line. You see that that ear gut is not coming down over center of cleft. It's tracking off to this side. Now, all feet are different. If this horse toed in, then it would track over this. Let's assume this horse is a little bit pigeon-toed. So the capsule's turned in. Where are we getting a joint change? That could bring this over this foot, this heel. If the foot was facing the toe of the foot was facing the other direction, then the ear gut could land over this heel. Now, I've learned over years of experience how to set my shoeing intervals. I look at when this fetlock falls. If this fetlock falls over center of cleft, if the horse is walking, well, that can go a longer period of time between shoeings with less distortion. But if this ear gut falls off center of this cleft, I would have to put my shoeing intervals closer together. This horse, I would probably set up at about 4-week shoeing intervals. And then I have a certain trimming protocol that usually will, in time, as tissue develops into the movements of the bones, in time, this can actually change. It can come further over to center of cleft. So we can throw that off through a trimming technique, simply how the foot is trimmed. Trimming intervals are very important when it comes to shoeing horses. It's very hard to help a foot if we're shoeing horses from 5 weeks beyond. Extremely hard to control. Now, if you had an older horse standing out in pasture, horses standing out in pasture, well, I suppose you could stretch that out. But an active horse really is a high maintenance item to keep that horse sound and a foot to function well. So now we can advance and look at, take the skin off, of course. Now here we see the skin has been removed. And this is what we call a digital cushion. It lays between the ungual cartilages that are on both sides of the foot. Now when the foot lowers, when this bone lowers, it has to push into the digital cushion. That's a good thing because it cushions things and works both ways. It can cushion the descending load of the PIII bone, but it can also cushion any ground force reaction that's going through there. It's just it's dispersing energy. If the horse didn't have it, I don't think we would be riding him for very long. So I'm going to put this into motion. And we can see now that the bones have to transfer between the ungual cartilages. And then it comes up. So these ungual cartilages are important. They need to be flexible. If they're not flexible, then there can be a problem developing that they can't move out as well. How do they become non-flexible? It's called side bone. Irritation to tissue. When tissue is damaged in the human body or in horses or animals, when tissue is under stress, the body will try to protect it, and usually in its way of protecting it is to lay down material to make it stronger. For an example, let's look at the top of this ungual cartilage, the tip here. You're going to see a ligament come up right here. You see when that ligament stretches out, that pulls the ungual cartilages upward and straightens them out. And then when the limb starts to fall, then the cartilage can be out of the way. But this tip can be under stress. If when heels are raised, that changes the whole dynamics of this foot, and it can put more stress onto these issues here. So we must be careful about how a foot is trimmed because of soft tissue. My advice to a horse owner or to trainers, that if you change farriers, I wouldn't ride that horse for a couple days. I would walk the horse around, because soft tissue needs a time to adapt. It's called physical therapy. Once the tissues adapt to the new trimming technique, then you can start using the horse and graduate up into more of an active type of position or situation for your horse. But always go careful after you've had your change farriers, because it's hard to find two farriers trim alike. They all have their own idea of how to trim a foot, and so they change the trims from one person to the other. Now, I'm getting off subject. I apologize for that. But when this tissue that attaches to the top of this ungual cartilage, it attaches to bone. That puts tension, and this cartilage can start laying down fibrocartilage if it's under heavy stress. And if the fibrocartilage isn't doing it, then it'll lay down more calcium and it will become more bone-like. Now, the same thing happens to the lower portion of the ungual cartilage that's inside the foot. That can actually be stressed, and I think I've covered that in another topic, but that can become bone-like, and that's called side bone. Eventually, these can grow together. The two bones, the development of bone can grow together. And also remember the side bone has direction. So look at what type of heel is on the horse, and you can start getting a picture of the type of direction or what's pulling or causing the side bone to have direction. Now, another thing we can look at is how this tissue is forced outward here. Watch when the fetlock descends, you will see that this tissue is pushing outward. It has to go somewhere. This is like, think of it as a balloon. I'm going to use this balloon analogy in two parts here. But when you push down on the balloon, it spreads out. Well, the digital cushion is locked in on the top of the sole. And if the sole doesn't flex very much, then that's going to stop that movement, and it's going to increase the movements on the side direction of the digital cushion, which can push the ungual cartilages out, put more stress on the cartilages. And also watch this area right here. When the fetlock comes down, you will see it push out and lift up a little bit. Here it comes down, it's pushing out, and right here you can see a little bit of a lift developing here. Well, that'll put a lift in time. That will put a lift in your hairline, because that now is pressing against the coronary cushion. There's a coronary cushion in here, and it's more balloon-like. And so when it gets pushed out, it can't go down because it's locked into the coronary groove. So it can only go up. And that upward thing can change this hairline. It'll put a lift in the hairline in that area. Now, if you raise the heel on the horse, that gets a heavier lift and further back, because as you raise and lower the heel, you change the DIP joint, sometimes referred to as a coffin joint, but you change that. Here, I can show you right here. We can take this bone and raise the heel. You notice how all of these joints are going to change, unless the tissue is very tight. If the tissue is very tight and you raise the heel, it'll more or less bring the toe back. If it's a front leg, it'll bring the toe back under the knee. Now we've created a lot more problems, which are mentioned in other lectures. So what I'm going to do next is remove the frog pad. You notice that this horse does not have a frog anymore. It's gone. We have our superficial flexor tendon that comes down and bifurcates or divides and attaches to this area of the P2 bone right here and here. So that puts a different movement to the foot. The deep flexor to the foot moving in a flexing movement, and then the deep flexor tendon widens and comes down and attaches right here to the semilunar curve or crest of the P3 bone. This is the coffin bone or the P3 bone. This would be your P2 bone, P1 bone. So that has a different role to play in the foot because its attachment is here, and that's going to have more effect on this joint. So nature's done a wonderful thing trying to put this horse together. It's our job is to protect it and take care of it because it's not perfect. If horses were just out in the wild, there's very little stress to them. But when we start riding horses and start putting demands, then care for the foot really needs to be increased, not only for the foot, but for all of the tissue. Therapy is wonderful for adjusting tissue. So keep that in mind. Someday you may be required to do walking protocols for your horse, or stretching exercises are very good. So let's put this into motion. You see how everything is descending, but it's descending without the frog pad. It's just descending out of control. It's going way down. So when people call the frog pad a frog, it's easy to just cut it out, do what you want. But if we would call it a pad, it would have meaning and we would protect it more. It's a very important function for that to be there because it helps stabilize all of this movement. Look how wide this heel is moving. Have you noticed that the heel is moving without a frog and without the support of the frog pad? It's moving, it's extended its movement. It's really out of control. So the frog definitely has an important thing. But our question is, how come this heel is moving without a frog? Because we're told all the time that the frog pad moves the heels. Well, there's no frog no pad in this horse. And so the heel's moving. So this is interesting. So now it gives us a challenge. And I love research because seeing this happening, and now we're dealt with a challenge to understand what's going on. So we can take the digital cushion out of this horse because we want to put a bigger window into the foot. So we remove the digital cushion. This tissue is called a distal digital annular ligament. And it's easy to explain an annular ligament. For farriers taking a test, if you can't think of it, just call it a binding ligament. Because annular ligaments, or veterinarians, maybe you could get away with it also, calling it a binding. It's an old term used. We don't use it very much. But an annular ligament is a binding ligament. I better not, I'm getting off track. But connective tissue. All tissue in the body is connective tissue. Believe it is. And so I used to tell my students, if you're taking an anatomy test and you can't think of the name, just write down connective tissue. I mean, partially, you'll be partially right. Maybe the instructor will give you a little credit, but I wouldn't, that's for sure. They need to, since I told them that, they couldn't get away with it, but it was fun. So let's look at this foot in motion. And now we can see the descending load. Remember where the ergot was coming down over central cleft, and look at this foot is loading more on this side. Keep forgetting that cursor, but our ergot, remember, it was coming down on this side of the bar of the frog, not over the center of the cleft. And so now we're picking up some severe movements taking place in this foot. I want you to look closely at how the bar is being loaded. This is very interesting because when the bars are loaded, the heels move. On this particular horse, the bar is loaded more so on one side than the other. There's ways of adjusting this load. It's not an even load coming off of the navicular bone onto the sole body or onto the bars, so we're having trouble, stress there. Most people adjust the foot, the PIII bone, by altering the plane of the capsule. Well, that can cause things like this. If you alter the plane of the capsule, you can throw the weight off internally on sensitive structure and start damaging other things. So there are ways to help this descending load. An important item here to recognize is watch this bar when it's on load. You notice the angle changes. When the angle lowers, the heel widens. When the foot comes up, the bar straightens and the heels narrow. So repetitive action on a horse can eventually beat everything down inside the foot if it's not properly taken care of. We have to protect recoil. And if we don't protect the recoil, then this tissue can get knocked down, and pretty soon it quits recoiling. And now we have developed a flat foot, a flatter type of foot. But horses that have low angles to the bars have wider heels. Horses, and usually a lower side wall like this side. The horses that have straight angles to the bar generally have narrow heels. We have all kinds of methods to widen and lower heels. Well, you have to counter what's causing the heel. That's the bar angle that's causing the widened heels and the narrow heels. So all of these gadgets that we apply to feet, either in the toe, a toe that flexes it, a shoe that has a pin that flexes it, that, you know, in some aspects that might have an influence on changing bar angles. Chadwick spring, I think, is a dangerous thing to use. That's an old-time method of spreading heels. I think they used to use them a lot on walking horses, other horses too. But what we have to concentrate is bar management. How do we narrow a heel? We can increase the angle of the bar. That's pretty simple to do. We have to be careful because we can do too much, and then our heels will come in very close. See what else I have here. Oh, the navicular bone. Now, the navicular bone can pick up some chips. You see, bone chips in the navicular bone can be unilateral or bilateral. That simply means one side or both sides. This bone, I picked, this is not the bone out of this horse. The navicular bone runs right through here, you know, right in the cut through here. And so as it loads, there's tissue involved, but the navicular bone is putting pressure onto the bar, or the bar, vice versa, semantics, the bar is putting pressure on the navicular bone. But what happens here is usually the majority of chips on the navicular bone are on the lateral side. All evidence, in my work, all evidence tells me that most likely when the foot hits the ground, the secondary movement is, what is the PIII bone? What part of the sole is the PIII bone landing on? And it's generally the wider, the lateral side. That would make a good study for someone that has the equipment to do that. Because the lateral sides of feet usually have more stress. This would be a lateral side. You see how flat and wide the navicular bone is here, or wide it is here, and short? That's a medial. This is our sagittal groove, and the narrow or longer side is the lateral side. So right here and here on this bone, which isn't out of this, is telling us that there's more going on the lateral side of the horse's foot than the medial side. You see the same measurements on joints, the way a pastern joint forms, the way the navicular, well, we just talked about the navicular bone, but even the coffin bone shows more width on lateral sides. Something has to be causing that. So for veterinarians, again, these chips are usually in the area of the bar when the pastern descends. Again, we need some way of protecting this navicular bone and protecting the heavy loading. We can soften the load in the foot. That's called the use of an orthotic. Horseshoers haven't, that's becoming quite popular now, where horseshoers want to put an orthotic. It's generally a two-stage silicone putty. I do believe that if it's used improperly, they can cause damage. So I would recommend if a farrier is putting an orthotic in a horse's foot for the first time at least, that he works with a veterinarian, because a veterinarian can use radiographs. They can do before and after to see the effects it has on elevating the bone and also pastern alignment. Best way to improve a pastern alignment is with an orthotic. You don't have to alter the capsule to improve pastern alignment. An orthotic will do that. So it's amazing what they will do to horses. And horses, everything improves when a horse is trimmed. Take the heels off a horse. I can't stress that enough. I don't think you can take enough heel off a horse's foot. It's so beneficial for the horse. I should do a lecture. Maybe I'll work on that. There's so many things that can damage a horse's foot when they have that length of wall in the heel. Quarter horse people, if they don't realize how short the workability of that horse is when they put heels on them. And look at all the breakdowns those horses have. Then you could compare that to a quarter horse that the farrier is eliminating the heel. Talk to that owner, talk to the rider of that horse. It's got a better moving shoulder, better moving stride, and a lot less breakdowns. Just start asking questions. Don't pick on the neck. Don't say, oh, that horse needs heel. Say, how is your horse performing? That might be a good question to ask, because it might give you a good idea of why your horse is breaking down so much when it's got that toe trimmed so short and those long heels. Worst thing anyone could do to a horse, health and welfare, is to raise him in the heels. Sorry, I got carried away, but this really bothers me because I look inside feet. I know the damages that occur from that. Bowed superficial flexor tendon is usually a horse that has heels. Just look at hind feet, hock injections. Look at how much heel's on the foot. Eliminate those hocks. I mean, not the hocks, you don't want to do that. But eliminate those heels, and I would guarantee you that the majority of those hock injections will go away. Again, if the farriers don't understand, well, some farriers do, excuse me for saying that, but we're in this program to cut those toes so short. The toe has a very important function. If you get a good functioning foot working for you, you don't have to worry about the word breakover and all this nonsense. It's because the foot is distorted, and so they're just bastardizing the foot instead of trying to understand the reasons why the foot is distorted. And it's got to do with the arch, the collapsed arch mostly. Here's a good one. So we've been saying that the bone moves inside the foot. The bone's descending and loading. I think I can show you quite easily with this. So this is a video that I borrowed from, it's courtesy of Epona Mine, John and Monique Craig. They're great people. They do a lot of, Monique is very passionate about her research, and she studies it harder than most farriers have ever studied a foot. So with this, I can show descending movements of the bone. So the two red lines, I put these two red lines in here, so you can see that those are stable. Now you can see that as the limb loads, the PIII bone lowers into the sole body or onto the arch. And this can have devastating effects on the horse when the bone is loading onto the arch. Imagine a heavier horse standing doing this, or a horse, action increases, speed increases the force. So the harder you train these horses, the more often you're going to have a breakdown. I just don't understand where their mindset is. I mean, they wouldn't train themselves that hard because it'd be sore, but yet they'll do it to a defenseless animal called a horse. Another thing I'd like you to watch is this. Here, we have another marker in this foot, a couple more. So we put this marker here, and this marker is at the depth, the tip of that marker is at the depth of the commissure. And this shows movements of the commissures, or of the bars. The bar is loading, it's descending down with the body weight, but notice that there is an angle change. That angle change can change the angle of the bar. All of this goes, so if you just start thinking about the causes of a flat-footed horse, you're looking at them right here. And then again, we can put on all that extra workloads and stress and heavy weight and things like that. So let's look at our conclusion. So crushing of the bar in the midsection. So we talked about this being the midsection, right through the foot here. Here we see this is the bar coming up here and down, coming all the way down, circles around, comes up the other side. The bar is weight bearing. All of the lighter color you see on the top of this sole is PIII bone loading it. Sometimes they load it heavier than others. You see, the bars will hold the PIII bone off the sole a little bit. But when the bone goes into a positive palmar position, then we start loading, see load happening more forward onto the sole body. If the bone goes into a negative palmar position, then we would see more stress or damage in the heel area of the foot and more collapsing of the bar. So we can Well, I better stay away from there. Get some people, unless you have good knowledge, you could get in trouble. That's why when applying an orthotic, you really need to work with a veterinarian for a while, because he understands soft tissue damage, and he can recognize with the use of a radiograph, he can recognize foot changing. If it's changing too much, you better alter what you're doing. This foot is fragile, but it's also very manipulative. So, but this is a severe bend in the top of our bar. And then another thing to consider is soft tissue damage here. So I like to use certain analogies because they seem to make sense to me, which is a little funny. A lot of things don't make sense to me until I study the hell out of them, but and that's my research. So, but you can see my analogy is if you have a sock, you're wearing a sock inside your shoe, and your foot is moving too much. Let's say it's a boot and it's not laced up, or it's not tight, very tight. Your foot will move more, and then pretty soon you have a hole in your sock. You wear your sock thin. And that's what's happening here. It's just we're getting a lot of movement from the descending load of the P3 bone, causing this to wear thin. Now, we also have non-sensitive lamina in this foot that's being destroyed and crushed out. What is between these leaves, the leaves of the non-sensitive lamina, is sensitive lamina. Well, sensitive lamina has nerve endings. It has vasculature, arteries and veins with nerve endings. And so this horse could be feeling this action for a while. There's something about nerves in a horse's foot that finally they just get beat down so much that they turn off. Well, that might be a good thing for the pain for the horse, but also that tells me that a horse doesn't know where its feet are landing. And that's very important. Watch a horse freshly shod, and when you're working it, and its feet are doing fine. But if you have those shoes on that foot for a long time, what happens? They kind of lose the feeling of where their foot is, what it's doing under their body. So keep in mind that we have to refresh these feet once in a while. We need to get all of this stuff off them and let them walk around for a while barefoot. In the old days, the show circuit was short, so horses had a chance to rest between the summers, and that's when the farriers could achieve a lot of help for the horse. Then they would go back into shoeing. But today, the shoeing schedule is year-round for show horses, and they don't get a chance to have their feet rest and recuperate from some of the damage. All of this damage will heal. Just remember that once tissue is damaged in the foot, it will heal, but it'll never be the same. So you'll always have you have to be more careful, like a boat tendon. The boat tendon will heal, but it'll never be the same. So let's advance a little bit more and look at the causes. So here's the P3 bone on this sole. You can see that the sole's modeling. The sole is modeling according to what the bone is doing. And this actually works both ways. The sole can change rapidly. Change farriers, you may get different signals to the foot, which can cause the angles of the sole or the arch to change. Well, it takes time for the P3 bone to change. Wolff's law, the bone's going to model to its stresses. So it takes time for that. But on the other hand, if the sole could actually model to the angles of the bone. So if you have a flat arched bone, then the sole will model to that and the sole will be flat. So a deep arch to the bone, the sole can fill in and model to that, and you'll have a deep arch to your sole body because your bone arch is deep. So another thing we can look at, because we're talking about causes, the bone is building a stress bump. Well, bone will model to pressure. That's Wolff's law. But the P3 bone, the edge of the P3 bone doesn't remodel. It's designed to remodel. But because we don't know very much about the internal functions of the foot, we don't know how to protect that edge of the bone. But if we can improve circulation and take the stress off the edge of the bone, it will remodel. It just gives up. It tries. It's always trying, but it gives up. See, this is a very young bone here. And it's very flat arched here. It doesn't have much of an arch. It has nothing's developed well in here. But it's going to grow and it's going to maintain its modeling. It will keep, all of this will remodel in time. It's young enough to do all of that. But as soon as we start riding it, then we don't really allow this foot to adapt or to rest from that workload. So just keep in mind that someday we will say we can bring bone. I'm hoping someday. I kind of have a good idea of how to do this, but it has to do with the arch and it has to do with increasing the stresses on the dermis. A flat foot, the dermis is flat. It's compressed, so the circulation is kind of altered. So we have to. It's going to happen. If anyone wants to do research in this area, you have the equipment and the facility to do the research. I tell everybody, I'll be happy to help you. My name, I don't care at all about my name. It doesn't have to be shown anywhere. What I care about is the horse. And I wouldn't be able, probably your pay grade is higher than mine, and so I probably wouldn't be able to help you in the technical knowledge of things, but I can cut your learning curve down, and that would help quite a bit. So keep that in mind, that I'm willing to help in any way I can, because I care about this animal, and I get a little touchy here, but I really would like to be able to see it improve. So I would like to say thank you on our discussion on pathologies in the midsection. I hope this will help people understand a little more about why horses can go lame. We can't blame the farrier for everything, because a lot of the lamenesses that develop in the foot are soft tissue damage, which causes from exercise. A horse standing around in a pasture doesn't usually go lame very often, but a horse in training has a lot of problems. So we need to maintain their feet very regularly, at least shoe them once a month would be very beneficial. If it's a high-stressed horse that's losing bone and the foot's going flat, I would increase that shoeing to maybe 3 weeks, every 3 weeks, until the foot stabilizes and comes around. I can't emphasize that enough on regularity in shoeing. So again, I'd like to say thank you, and have a good evening or a good day, or maybe a nice breakfast. I don't know. Take care.